Canada is a pretty big country, typically described as being totally diversified. But what a lot of people fail to realize is that within all the similarities between us, there are inequities in health, especially in Canada's Indigenous populations. First Nations, Inuit, and Métis populations of Canada are often at a disadvantage in our health system, whether it be due to institutional racism, media portrayals, or something completely different. To be more specific, the national average for infant mortality in Canada is 4.4 per 1,000 live births. In Inuit, the infant mortality rate is 23.1 per 1,000 live births, a 1 in 50 chance of dying before their first birthday. The Inuit infant mortality rate in Canada is comparable to lower income countries in the world such as Indonesia and Zimbabwe. So what are the causes of infant mortality in Inuit newborns? Studies have shown that Inuit infants are 7.4 times more likely to die of sudden infant death syndrome than any other population in Canada. Inuit mothers give birth to more premature babies than non-Indigenous, First Nations, and Métis people in Canada at 11.4 per 1,000 live births. Stillbirths are almost twice as common in Inuit than the rest of Canada. Infant mortality is preventable in most cases, and a higher rate of mortality in one population over the rest in one country shows a gap in health that needs to be fixed. A new theory that has been proposed to help explain these inequities in infant mortality is a gene called CPT1A Arctic variant. This is basically a type of gene that essentially gets turned on because of some benefit it played for Inuit ancestors in more ancient times that has been passed on to Inuit babies today. This gene makes the baby unable to produce an enzyme that breaks down fats. It significantly decreases a baby's ability to fight infections due to big dips in blood sugar levels while fighting infections. This genetic variant type is only present in circumpolar humans like the Inuit and seems to impact on how a baby can survive illness at a vulnerable age. But there are cases that genetics alone cannot explain. Statistics Canada has found that there are many cultural influences on infant mortality rates. Most often, Inuit mothers were young, unmarried, or without partner support, and least likely to have graduated even secondary school. Many of the other social determinants of health come up here, like income inequality, food security, and social isolation. Social risk factors like these increase the likelihood of infant mortality, even in non-Indigenous populations. Inuit mothers and babies experience higher levels of racism in hospitals. Ignorance among staff and a lack of training and culture contributes to the complexity of accessing care for mother and baby. An important aspect of healthcare is that all cultures cannot be painted with the same brush, and treatment should reflect this. For many Inuit mothers, especially those living in rural and remote communities, they have to be flown out of their homes to different provinces to give birth if they want to have any sort of physician care during their birth. Infants in this situation are often more sickly than those born in their own community. Giving birth away from home increases stress by a hormone called cortisol, creating a difficult environment for birth. This method of birthing is often very costly to the healthcare system, as well as increases risk of infection when being flown just before and after birth for mom and baby. It's not all bad, though. We are looking for ways to decrease Inuit mothers' risk of losing their infants at such a young age. One great idea out there is the baby box. Baby boxes are literal boxes that are donated to every mother that receives pre- and postnatal care. Essentially, it's just a baby starter kit. They contain essentials such as diapers, formula, health kits, and warm clothing. However, the most ingenious part of the design is that the box comes with a mattress in it that converts to a crib for newborns. Inuit babies are too often placed in unsafe sleeping arrangements due to overcrowding or just misinformation. Hopefully, baby boxes could eliminate this. As an example, Finland gives every mom a baby box and has reduced their infant mortality rate to 2 per 1,000 live births, which is less than Canada's. In addition, the access to healthcare professionals at delivery is especially difficult in the north. We know that having more healthcare professionals in northern communities would significantly benefit women, as rates of infant mortality have dropped in towns such as Attawabascat, Ontario, with the addition of 2 midwives into the community. Essentially, bringing more midwives gets better outcomes. Another solution could be education. New Zealand distributed information on correct sleeping positions for newborns to reduce risk of sudden infant death syndrome to every new mother in hospital, which showed a decrease in the country's overall infant mortality rate. Education can be a big step towards making it safer to be a newborn Inuit, just like it did for New Zealanders. So what should you take home from this video? We know that Inuit babies are more likely to die before their first birthday than the rest of the Canadian babies. Sudden infant death syndrome, premature birth, and infection are often the cause of death. Both social and genetic factors may play a role in the disparities in infant mortality rates, which means that we might be able to decrease the Inuit infant mortality rate. Baby boxes, local midwives, and education are all good ideas to help reduce the inequality in health that we've seen here. Thank you for watching.